afternoon, and welcome to the third in a series of Alliance Fall Conference preview webinars. We're very happy to have over 169 people enrolling on our webinar today. So obviously, sunshine is a very hot topic. So we're glad that you're taking time to join us. I would note that although we had originally advertised the webinar for a 30-minute window, given the interest that we're already seeing, please plan on this webinar lasting more in the time frame of 45 minutes. So just wanted to give you that information up front. So with that, I will also give you some other information, sorry about that, about participating in the webinar today. You can collapse and expand your panel to see more of the screen. You can select your preferred audio mode, whether you're on the phone or you're using your mic and speakers or your speakers, since this is a listen-only call, and then submit your text questions via the chat function. And we definitely encourage you to submit your questions throughout the call. We cannot guarantee that we will be able to get to every question, but so you know we are keeping a record of them, and we'll be aggregating questions and then actually turning around and submitting more questions to CMS for their clarification. So please, we definitely want to hear all of your questions, and we apologize in advance that we won't be able to answer all of them, but we will try to answer the top questions first. So that said, I do want to introduce our presenters and turn it over to them without further ado. Jacob Coverstone is the Director of Education at ACEhp, and he is a newly elected member of the Coalition for CEHP Board of Directors. And Damon Marquis is past president of the Alliance Board of Directors and the current president of the Coalition for CEHP. And we're very, very happy to have both of them with us today. Before I turn it over to them, I do just want to note that we have an exciting addition to the lineup at the Alliance Fall Conference, which is taking place the week of October 15th through the 18th in Baltimore, Maryland. We have secured a member of the of CMS's office that oversees the Open Payments Rule, or the Sunshine Act, and we expect either its Director Shantanu Agarwal or Deputy Director Anita Greiner will be joining us for a luncheon keynote and Alliance Town Hall meeting on Thursday, October 17th. So mark your calendar, and we hope that everyone will consider joining us then. So without further ado, let me turn it over to Jacob and Damon and allow them to get started with today's objectives.
Hello, everyone. We've got a lot to cover today. As Bryn mentioned, we're more likely to go into about the 45 minutes, and we hope you'll be able to make time for everything. As you know, this webinar is going to focus on the Physician Payment Sunshine Act, some of the impacts that it has on the health education community. But as a disclaimer, I am not a lawyer, and it may be wise for you to have the final rule reviewed by your House counsel. In fact, Damon made a great note as we prepared for this webinar. The more that you look at this rule, the more questions come up, and you'll see some of our own questions throughout this webinar. I work at a CME provider. I'm an Alliance volunteer who's been involved in the evolution of the Sunshine Act for the past 2 years, mostly as a member of the Advocacy Committee, and I'm Jacob, by the way. Damon, do you want to introduce yourself?
I think people know who I am. I'm the Director of Education and Member Services at the Society of Thoracic Surgeons, and I've been spearheading advocacy work for the Alliance since I first came on the board of the Alliance. So watching this develop over the last 6 or so years has been an interesting evolution. We've developed a good relationship with CMS, and I think that relationship will get us the answers that we need. So back to you, Jacob.
Oh, yeah. So we're going to approach this webinar in a few parts. So first, we're going to give an overview of the Sunshine Act from a very high level. The goal is to try and relate this to a broad array of provider types, but the nuanced impacts of Sunshine are probably too technical for us to address for each member section in great detail. Then we want to address a few myths or oversimplifications about the Act and highlight some areas that, in our talks with providers, many organizations haven't considered. As a side note, I really wish we had answers to all these situations, but many solutions will be different from organization to organization. The implementation of Sunshine is so new, it doesn't seem like anybody really has all the answers. We're hoping to have more details at the fall conference. As Bryn mentioned, we will have a representative from CMS there, and we have a list of questions collected from Alliance members awaiting comment from CMS. But right now, what we want to do is get you thinking about some odd or unique scenarios. And hopefully you'll begin questioning your own practices and trying to figure out areas you might need to reevaluate. After all that, time permitting, we'll do some Q&A. So this is from the CMS Open Payments final rule. And as we progress through this webinar, you'll learn why it's at least a bit ironic. And it highlights a key point. CMS in Washington really don't understand CME, our industry, or what we do, and it's why establishing this relationship has been so important. The Advocacy Committee, as well as other industry groups like the CME Coalition, NAMEC, other individual providers, did and are still doing a great deal of work related to this and other issues. Each of these groups contributed to success in having changes made between the first draft of the Open Payments Rule and the final rule that came out this February. And seeing these changes and missed opportunities is something that really fuels the Alliance's coalition now. It's intended that the coalition should provide our industry a unified voice so that we can educate lawmakers as we're advocating. A lot of what we're going to discuss today are the gray areas and unintended consequences created in the wake of the final rule. And those are the items that will create the burden upon entities that organize and oversee events and conferences, as CMS puts it. Bryn, can you give us the next slide there? Thank you. So what is Sunshine? This was first introduced in 2007 by Charles Grassley and Herb Cole. And the bill initially failed to pass, but was successful as part of the 2010 Affordable Care Act. The Open Payments final rule outlines the requirements and expectations the Centers for Medicare and Medicaid Services have for collecting and reporting data. A link to the final rule is provided on the screen, and the Alliance is going to make these slides available after the webinar, so you don't have to write that down right now. Bryn, if you can. Thank you. So I've read a number of explanations and justifications for the Sunshine Act, and most of them talk about broad impacts and patient safety. But before we really delve into what the rule is, I think it's important to look at what it isn't. We hear all the time that there's too much influence between industry and physicians, opinions about how industry funds do or don't contribute to biases, and there could have been legislation passed that would have banned any kind of funding or industry support. There are a lot of people out there who want that. I think Charles Grassley himself has made statements like that. But instead of a directive like that, we got a question. How much money or transfer of value is coming from applicable manufacturers to U.S. physicians, and where specifically is it going? Bryn? And that's the real goal, to figure out what's going on. And we should be happy about that, because this is actually a level-headed, albeit far-sweeping approach to the issue. It's not a bad question. Is this a too-big-to-fail situation? What would have been the effects of pulling out all industry funding? Like any bill, this one's a compromise. A lot of people are trying to do a lot of things or claim that some things are being done, but it's worthwhile for us to take a moment and focus on what wasn't done. So this slide is for reference, and you can read it now or after the fact when the Alliance hosts these slides. It's also on the CMS website and in the final rule. The basics are that CMS will be collecting data from applicable manufacturers, aggregating it, and disclosing it to the public. And the question of who reports the data, some people have noted that industry are the ones providing the data to CMS, and they're treating this like it's an industry problem. But I think, as we all know, if it's a problem for your supporters, it's now a problem for you. It's possible your exhibitors or advertisers are going to need a means of collecting this data, and it may be written into your LOAs with them that you will be the ones collecting or providing this information to your supporters. This is the impact upon providers. Like always, we're the middlemen. In the final rule, CMS, oh, can you jump back one, Bryn? Thank you. In the final rule, CMS clarified that applicable manufacturers cannot remain deliberately ignorant. So they have to try and gain access to this information if possible. That was one proposed strategy, and the draft is, well, don't tell them who, or they might not want to know, but that was thought of. And this is explained in more detail in page 33 of the final rule. In fact, that same page does a good job of explaining the entire rationale behind tracking indirect transfers of value, and they provide the definition of no on page 66. We can advance there, Bryn. So what are other societies tracking? Based on listservs and other discussions we've been having, it sounds like many societies are now going to begin collecting NPI numbers. And physicians can find their NPI easily at npinumberlookup.org. Quick Google search will get you to that website. Just search for NPI number. And this information should be logged. Ooh, keep on that slide, Bryn. Thank you. This information should be logged in an area that is easily reportable, somewhere in your database, some spreadsheet, somewhere you can access it, because you'll be sharing it and running reports with this information. And this might mean customizing your membership database or registration forms. My society is doing both. A lot of groups are setting up systems with advertisers and exhibitors at their meeting so that they can facilitate barcode scanning or some similar way for their applicable manufacturers to track who is receiving items. If an exhibitor is giving away something that costs them more than $10, even at large annual meetings, it appears they'll have to log who receives it. We can advance there. So these are the different types of demographic information that will be reported for each category of transfer of value. And we'll get to the categories at the end. That applicable manufacturers will be sharing about recipients. We're not going to dwell on this slide because, again, we're pressed for time. So we want to get into the oversimplifications that we mentioned at the beginning. We've heard a lot that items under $100 don't need to be reported. And that alone isn't accurate. It's the $10 threshold that doesn't need reporting unless the total transfer to that person is over $100. So transfers under $10 need to be tracked, even for small CME events, although large and small have not been adequately defined by CMS, and some supporters are coming up with their own determinations of what large and small are. CMS has said they're working on a clarification for this, and they hope to have it by December, but right now there just isn't a definition. It's only that applicable manufacturers don't have to provide this information to CMS unless the sum total of all of these small payments will be above $100 or another transfer of value is provided in excess of $100, but the data has to be tracked in order to determine this. How would a representative from an applicable manufacturer know for sure that the person they're giving something to hasn't already received enough value to qualify for above 100? It's all going to need to be tracked. And some manufacturers wanted to provide smaller values right to CMS instead of worrying about the $100 aggregate. And CMS actually decided in the final rule that they would accept these small totals. So just because it's not required to be reported doesn't mean that some manufacturers will not be reporting it. I know I'm moving fast here. And, oh, still on the previous slide, Bryn. This is going to be an actual quote here from page 69, where they do start to talk about the exceptions for large meetings. And they do state that payments or other transfers of value less than $10 in calendar year 2013 provided at large-scale conferences and similar large-scale events or events open to the public do not need to be reported or included in the aggregate threshold in calendar year 2013. Stay with me. Even if the aggregate total for the covered recipients exceeds the aggregate threshold for the calendar year. That's on page 69. You can read it yourself there. But if you have a supported giveaway with a value greater than $10, even at a large meeting, some groups have expensive handouts that they offer as advertising opportunities. Those would still need to be tracked. So it's only that items under $10 in value in calendar year 2013 at large events, where large is not defined, are exempt from reporting in this instance. If you're unable to facilitate the kind of data tracking and reporting we've been talking about, do you ensure that your exhibitors will not be giving out anything with a value greater than $10? That would be something you'd have to consider in your exhibitor prospectus. And these are just more of those little gray areas that need extra consideration. Okay. Thank you. So this has implications for all meetings, large and small, and things like enduring materials. There isn't an exception listed for the creation of enduring materials. The rule itself, section 403-904G, or page 68 of the final rule, is for special rules for payments or other transfers of value related to continuing education programs. It only discusses CME events, yet there's language that indicates that any compensation for the creation of CME content shouldn't be reportable. The rules themselves do not clearly exempt honoraria or reimbursements given for a person's role in creating enduring materials. This still means that everything at small meetings needs to be tracked as far as giveaways are concerned, and some items at large meetings, as we just noted. Not all CE systems also are grouped in with the whole CE is exempt approach. Let's see here. Go forward one. Thank you. This is the language that's in the rule itself that starts talking about unaccredited and non-certified education. And while it might seem straightforward, this issue is complicated by the definitions created within the rule itself for unaccredited and non-certified, and inversely for accredited and certified CME. The next slide here is going to start showing the actual exemption criterion for indirect transfer value reporting. And this is where things increase in complexity. It's important to review and probably study the exemption criteria for yourself and turn a keen eye towards your own organization's practices. Start looking for what isn't included. Reporting indirect transfers of value like speaker honoraria are exempt at events that follow all three of the criterion we're going to discuss here. The first is that the activity is accredited or certified for credit under one of these organizations, but there's specific caveats on that. While clarifying language that's in the rule itself, what we just shared discussed accredited and certified programs, you'll see here that specific systems are highlighted. And what's more, as we mentioned, CMS has their own definitions for accredited and certified CME, which we'll get into on the next slide here. Thank you. So this is on page 23 of the final rule itself. And the coalition currently has a question with our grouping of questions collected by Alliance members in front of CMS regarding the EAC, CME, and AMA honoring each other's credits. What's the impact of an EAC-CME certified activity, since they're granting credits honored by the AMA and vice versa. And here's an issue out of this language itself, which we're intending to ask CMS. The final rule defines accredited CME as being delivered by an ACEhp accredited organization, and certified CME as education put on by the AAFP, AMA, AOA, and ADA-CERP. It does not appear to cover organizations accredited by AAFP to certify their own activities when they're not also accredited by ACEhp, for example. The certified, still on that page, certified CME really, as they're defining it, applies to activities coming directly from the owners of a credit system, and accredited CME coming from providers accredited by ACEhp. And this is, again, one of those unintended consequences. And CMS has said that they may be revisiting different and additional credit systems sooner than they would revise other parts of the rule, but there hasn't been a timeline for explaining what sooner means. In the meantime, we're asking them about the specific wording, and you can read the language yourself on page 23. Now we can, so these are the other two exclusion criterion, and all three criterion must be met in order for indirect transfers of value at an activity to be exempt from reporting. And these are items that shouldn't be happening under the credit systems mentioned. Again, this highlights the real level of understanding that lawmakers have about the continuing education in the health professions, and why it's been important for us to get more involved in advocacy and educating those who have such an impact upon our field. So even if your activity falls under the listed exemption criterion, and you have to evaluate when something is part of your CME activity. Do you offer satellite symposia? Do you have non-certified sessions? This is where some reimbursement policies start to come into play. Do you pay honoraria for sessions happening at your meeting that don't carry CME credit? Those are not part of your CME activity in this case. They're just happening alongside it. And in that instance, there is no exemption. If it's a supported session, especially if it's completely supported by industry, that appears to be entirely reportable in this instance. So let's see here. These are the individual categories that applicable manufacturers are going to be reporting information to CMS with. The last category there in the bottom right of your screen is for direct payments, which ACCME's standards for commercial support would prohibit anyway, and only applies to those types of activities defined by CMS in the rule as accredited or certified. So information would only be submitted here if someone's doing something amiss. Other speaking would go into compensatory categories in the second column there at the very bottom. And the difference between the two faculty speaking classes revolves around whether or not credit was granted to it. We can probably speculate that some groups will be confused by this, and we may be responding as an industry in a year as why direct payments are being made to speakers at certified CME activities. It may just be that it's a flaw within the reporting itself. Now that was a lot to cover in about 20 minutes, and I do apologize for breezing through. The slides will be hosted later, and we wanted to be able to start addressing some of your questions. We've been getting a lot through email. We want to keep getting them through email, and we will be consolidating, aggregating those, and passing them on to CMS as well. But we wanted to open this up a little bit so that there'd be time to get some discussion underway. So.
Great. Thank Thank you, Jacob. And I do want to point out that on the slide right here, you don't have to copy it down because we will be sending it to you, are all the ways that you can also send your questions to us via email and to CMS directly if you prefer. So without further ado, I have a question. What is the definition of a large group? How many, and where can we find that in an official document?
And that's an excellent question. Right now, and that was actually asked of CMS themselves on August 8th, and their answer was, we'll get back to you. And that was when they were saying they hope to have clarification on that around December. Seen some supporters are defining it themselves right now to be safe, but it's something that you should be engaging in a dialogue with anybody who's an applicable manufacturer providing you funding. What do they define it as right now? I've heard that some groups are defining large as low as 50 people. There's really not a set number yet from what we can find.
Great. And we will be following up as, if we see in the near future that they do answer that question for us. We have shared their answers in the past, and we will continue to do so as they apply to the questions that our members are posing. So the next one is, could you elaborate on how the Sunshine Act applies to meeting exhibitors?
Good question. For starters, anything happening on your exhibit hall floor isn't part of your CME activity, but it is probably happening at a large conference. The key distinction is that the exemption for giveaways or transfers of value taking place at those conferences appears to be set at $10 or less. So a pen that's being handed out, probably not reportable unless it's a really nice pen. A USB flash drive, depending on the value of it, could be reportable. And so this is where the it's not reportable unless issues start to come into play.
A good example of that, Jacob, is if you have an educational material that's meant for patients that's handed out, that's not reportable. But if you have a educational material and a thumb drive that's supportive of that, the thumb drive very well may be reportable.
That's a good point. Even on the webinar that CMS had with, or intended for physicians, I think it was mostly industry folks who were on the call, they were asked if, say, a mouse pad that was handed out would be reportable, and CMS answered yes. So it's something that may need to be tracked. And again, we have to draw these distinctions between what has to be reported and what should be tracked. And this is where some of those distinctions get made. It's you don't have to turn over some information unless other things that aren't happening right now happen. Well, you still need to be able to go back, find that information, and have those records. That's one of the reasons that even industry said compiling these different aggregate totals and submitting them in bulk to CMS might be a problem, and CMS is now allowing them to just send small payment totals. It isn't clear whether or not CMS will somehow be waiting to see if the threshold of 100 is reached, or if they'll just be reporting $5 and $7 increments. We'll learn that after the reporting year closes.
So, Bryn, before you do another question, I want to clarify something, and something that Jacob and I have discussed several times. In this first year of collecting data and also reporting data, there are a lot of organizations that are interpreting the Sunshine Act, and I just consistently try to caution people that the only people that can give a true interpretation of the Sunshine Act is CMS. So yes. As you are looking at interpretations, and I can tell you I've received 5 to 10 different sets of interpretations, you have to ask yourself, is this a lawyer who's looked at this but isn't from CMS? Is this his or her interpretation, or is this in fact directly from CMS? Because the final rule, if you can have an interpretation that is not consistent with what CMS says, and if you're not collecting the data because you're following your interpretation and not that of CMS, you're going to have a problem. And another thing that I think we need to keep in mind is I think this first year is going to be very confusing and frustrating for all of us because while those of us who are providers are looking at this as, okay, how do we help help industry with this process? Industry has a real foot in here in that if they do not comply with the Sunshine Act, they run the risk of a fine. So each company, I predict, is going to turn to their legal departments, and for those things that are not clearly interpreted by CMS, industry is going to interpret for themselves, and the interpretations are likely to be different from company to company. So as we're all working with industry, we as providers are going to be facing a variety of levels of understanding and interpretation, and I think that's something that we have to work together on to minimize, if at all possible. I just wanted to get that in.
Yeah, I want to piggyback actually off what you were saying there, excuse me. And you make a great point and should have dwelled on a couple of things in more depth, but I wanted to get through a lot of information in a little time. It's important to have record and just a record process set up in advance here, and that's why we wanted to go over or at least expose you to some of the kinds of information that will be reported. The resolution process is actually kind of interesting, and this is something that got cut out of the slide deck for time, but I want to go into here. Now, once information is reported by industry, excuse me, to CMS, CMS will be consolidating everything and publishing it to physicians first. And this is where, if you're at a society, you might encourage any of your members to sign up for the CMS Open Payments notifications. There's also actually a really great web app or smartphone app that CMS has. There's an app for everything. That they can look at what's been reported about them. And there will be, I think it's a 45-day review period where physicians can go on, see what's been reported about them, and they can actually contest things. But if an item is contested, CMS is not intervening. All they're going to do is let the manufacturer who reported the information know that it's being contested. Now, if that manufacturer, in this instance, got that information from you, they're going to want to know maybe more information about it. So keep your records as well. Have a way to track this information, back it up, have these discussions when you're getting support. As Damon said, everybody's got a different interpretation right now, and it's kind of analogous to when the ACCME criterion changed. There were a lot of different interpretations, and we didn't even really know how some were going to be enforced until people started getting surveyed. This is another one of those issues where we're not going to know some of the final interpretations until we see how the process plays out. And even then, CMS might not know enough to change or clarify things until they see the kinds of data they're going to get. It's all very new right now.
So another area that I just want to quickly address is that obviously we want to encourage you to submit questions to the Alliance so that we can bundle them and get them into CMS. If you decide to go to the CMS website itself to submit a question, the one thing that I would advise or recommend is what I've learned through this process is the people at CMS really want to do the job right, but they don't necessarily understand our field. So when you write a question, for instance, I think a simple one that people from a variety of provider types would understand is the concept of a satellite activity. The reality is we have so many different definitions of what a satellite activity is that if you write to the CMS, first of all, they may not understand what a satellite activity is. Second of all, they won't understand context. So part of your question has to include education. You have to be very clear about what it is that you're describing and what it is you're asking, because otherwise they're going to come back to you and say, this is too vague, we can't answer it. So that's just a great point. Bit of advice.
Great. Well, I want to go back to what we were talking about related to some of the materials and what things like enduring materials. So let me ask a couple part question because I've gotten a number of questions in the same vein. First of all, so if you are accredited or certified, you don't have to report anything. Is that correct? And then,
sorry.
What?
Was that the full question, or was there a second part to that question itself?
No, there's more. They're sort of related. Could you elaborate how the Act is applied to enduring material and some of the other things that we've been talking about related to, is downloadable material sponsored by the industry event? If not, how do you place a value on that? What about if reportable items are in fact covered by your registration fees? If a giveaway from industry like a thumb drive is reportable, but if an accredited agency were to provide the same giveaway, it wouldn't need to be reported. It's a lot of questions about these materials that are part of a registration, or part of attendance, but often covered by registration fees.
Bryn, you might have to remind us some of the specifics in these questions, but I'm going to try and get into pieces of this. I don't have great answers yet. What I have is we've actually been doing a lot of looking at these exact kinds of situations. And when it comes to just CME in general, the wording within the clarifications portion of the final rule from CMS really seems to address that they didn't think about enduring materials. Because there's language that both says the fail-safes in place for creating these materials place it into a separate category which shouldn't then be reported upon. However, the rules for reporting themselves when talking about exemptions only start to mention events. And that's where things get trickier. And so while the intention may not have been to include them, by the simple act of not excluding enduring materials, right now they appear to be included. And this is one of those questions we're bringing to CMS. The issues related to giveaways and thumb drives. Bryn, can you restate, did you have that written down? Because there were a lot of components to that question.
Oh, I know. There are a lot of similar questions related to things like some thumb drives. So forgive me if so to clarify, giveaways from industry like a thumb drive is reportable. However, if the accredited agency were to provide the same giveaway, it wouldn't need to be reported. Is that correct? And let me just say, to add on to that, so the media used to deliver a syllabus material is reportable if it's not old-fashioned print material, if it's a thumb drive.
Good questions here. And this, I'm not going to say for sure that anything is correct when we're talking about exemptions yet. That's something that I'm just not brave enough to speak for CMS on that. But based off of looking at the rules themselves, in a situation where the USB drive was an essential component of the CME activity itself, and the determination of what goes on it, how it looks, etc. It's not an advertising opportunity. You're not branding it for some manufacturer. It might have your own logo on it. It has essential information for the CME activity. That seems to be part of your CME event. But if it doesn't have anything essential on it, if it doesn't have your abstracts or your syllabus content or a workbook, just handed out this way in electronic form, if it's used as an advertising opportunity to put branding on it, in which case for ACEhp you probably wouldn't want it to be considered part of the activity, then it's not part of the CME activity. And if the value's high enough, it probably should be reported. This is where we start looking at very similar outcomes, but it goes into, same way with everything really with CME, how you came about structuring it and designing it is one of the biggest components. In both cases, somebody gets a USB drive, but it's what's on the drive, how did it come about, whose idea was the drive, how was it branded, all these things factor in.
In the CMS discussion paper, basically they do say something that I find a little bit confusing that I want to clarify with them. That if it's the USB drive, I'll use that as an example. It shouldn't have any sponsor information in it. Yet, if you're using that USB drive as your program book, then you're going to want to acknowledge your sponsors there because you've got to disclose that to your attendees. I think the intent from CMS was that you wouldn't have any promotional material from your sponsors, but they're a little bit vague in the way they wrote that. So that's one of the questions I want to take back to CMS just to get them to clarify.
The way I was sort of reading that as well is, if when you open it up within your program book, there's a standard disclosure of, we received support, that's different than if there are logos on the outside of it or it's shaped like their logo.
Right.
And that seems to be, again, one of the intentions. And that's where the entire concept of indirect transfers of value starts to come into play. CMS really tries, just like the ACCME does, tries to make sure that it's not a way for direction to have been given. It's not, here's $1,000, can you give it to that person? Those are the sorts of things they're explicitly trying to track. And so it's not a way to launder or obscure the source of money. But if we're just receiving general support and we're using it for our meetings and it happens to be used to pay for some reimbursements, those are the things that start getting exempted.
Great. Well, let me get some more questions in here because I'm approaching 2:45. But how does the Sunshine Act affect who and what we charge attendees for CME meetings? Is providing education to physicians something that needs to be reported?
I'm not sure I fully understand the question. This doesn't dictate business practice.
We can follow up on that if you want to do that offline. Then let me go on to ask, does our CME office have to track this data? If industry is doing this already, perhaps our physicians should track this, but why does our CME office have to be involved? And I know obviously it goes back to the physician, but go ahead with the answer.
Just based off the recommendations, and this is one of those things that you don't have to unless you agree to for your supporters, but it may be a good idea to facilitate a means to help them get this information. And just think about situations where, yes, industry is tracking it, but let's say, again, that there's somebody on your exhibit hall floor giving away, a $50 item for whatever reason. How are they going to know necessarily what the MPI numbers are of individual attendees or even who that attendee was or, where, if they're licensed to practice in the United States? They may be coming back to you looking for a registrant list or trying to reconcile, they may have written the person's name down, but they might be looking for more information. And they may have required you to have that info to begin with. It all comes down to how these things are administered, but there's a lot of situations where, especially at larger meetings, it's going to be impossible without your help for these manufacturers to figure out who benefit. And they're not allowed to remain woefully ignorant because it was somewhat difficult. CMS, even in their webinar on the 8th of last month, really clarified that there's an entire section on exemptions related to buffet meals at large conventions, but CMS on that webinar said that you should, not you, but that applicable manufacturers should still report people who benefit from it if they're able to figure out who did. The entire exemption in the clarifying language for these large-scale conferences or those open to the public was centered around when it's just really absurd to figure out who took leave of it. But if there's a way, any way at all, they want to get the data, and they being CMS.
So it was my understanding also during the call for comment period that CMS was actually asked to provide guidance to CME providers on what to collect and even create some sort of a form. And CMS chose not to because we as providers are not the people that CMS and the Sunshine Act was written to address. It's the relationship between physicians and and industry. The question of why do we have to do it? I think Jacob answered pretty well that ultimately there's no mandate for you to do it. However, if you want to maintain relationships with industry, your industry partners may very well require that as a condition of supporting you. So that is an individual discussion you need to have, and if your CME department does not want to have any role in this process, CMS isn't going to say you're bad. Your industry partners may not be happy and may walk away from you.
And that's, yeah, one of the downsides, and that's where we really started this webinar. In fact, the comment that Damon was talking about is where the expectation slide we had in the very beginning, that was their answer, is they weren't going to provide guidance. There would be no template for providers because they didn't think it would be that burdensome, and this is on, or it's the responsibility of applicable manufacturers. It's just when you get down to these details, and as Damon said, if you're trying to keep good relationships going, if someone's giving you thousands of dollars in support of your activity and, well, they want outcomes data, and they always need information anyway, this could be another source of information or another requirement. As usual in the grants process, our rules are their rules.
Right. Well, I want to go back to a few more questions. I know we're going over even the 45 minutes that we had extended to, but we were getting a lot of questions about food, about how conference food for registrants fits into reporting and buffets versus plated. And I know you talked a little bit about that, but I guess I'll ask the question related to like this. What's our responsibility to the participant in terms of telling them what is being done with their information, and could a participant opt out of food and giveaways, etc.?
That's a great question, and that's one I think that falls under the category of no one really has that answer yet. We're trying, I think, as a community of providers to come up with our own answers for that, and there have been listserv discussions through the Alliance related exactly to this. There's explanations that may need to be given. Some groups are sending out messaging to all of their members explaining, here's what Sunshine is, and you should be signing up for the CMS open payments, and because of these new rules, we're going to be collecting NPI numbers. It depends society to society, organization to organization, of what your members need to know, what they expect to know, what you think the reaction to just being asked for this information might be. I think having an opt-out option is good, and this is just speaking personally. I've been discussing that within my own organization of if there is something like a nice supported giveaway that is paid for by industry, we might have a second option available, and we may have to ask people if they want it or not. These are just things that we're only beginning to explore, and our meeting is 7 months away. So people on different timelines, it's worth having the conversation within your organization.
Okay.
Damon, what do you think?
If Damon doesn't want to add to that, I'll just move on to 2 more quick questions, and then we will definitely keep record of your questions and aggregate and submit them, or point you to the right answers if they do exist already. One question is, if travel and/or honoraria that a physician receives for developing ACCME certified CME reportable. Example, physicians travel to a central location to develop a consensus that will later be written into an enduring material activity.
In that situation, the first question is, are you receiving funding for it? No society is going to be sending information directly to CMS. So this is only if you are receiving support, paying for anything to begin with, what you might be giving back to your supporters. Within that, I think that's something that really needs to be clarified from CMS, because the language within the rule, while it doesn't seem to come in the exemptions, the intention as they wrote it was not to include that kind of information. They then just didn't go on to not include it.
Yeah,
Okay.
in my looking at that, it's not a CME activity. It does not satisfy the 3 criteria. I don't know, if you're getting sponsorship dollars for people to come in to plan an activity or to write an activity, it's not the same thing as it being the activity. So I'm not so certain about exemption for that.
That's where the enduring materials thing, I think, comes into play a lot, because, if it would be the work, if they would exempt enduring materials, which they haven't explicitly done, I would think that the work that would go into making that material may as well be exempt. But, these are things that we have to get straightened out.
Right.
Exactly. Well, obviously, still a lot more that needs to be straightened out, clarified, answered, and I will remind that at the Alliance Fall Conference there will be a live activity, actually a couple, where on Thursday, October 17th, we will be having a luncheon keynote presentation from a representative from the office at CMS that is overseeing implementation of the Sunshine Act. We'll be sending out more information on that tomorrow. And that'll be followed by, that'll be part of a town hall type discussion and followed by additional panel discussion on time. So this is not a topic that we're going to stop talking about anytime soon, right? Right, guys?
No, I think there's also there's a session now being planned as well for the annual conference on this topic as well. So we're going to every couple months here.
Absolutely. Well, I want to wrap up and thank you, thank our presenters so much. This is obviously a tough issue to tackle, and we're trying to push out as much information to the Alliance members and folks who have a significant interest in this. So we appreciate your joining the webinar today.